So hello all, if you haven't met me yet over the last 2 days, I'm Eleanor Rees and I'm from the Office for National Statistics, which is the UK's National Statistical Institute. And today I'm going to talk to you about our measures of national wellbeing and our recent review of them. So the Office for National Statistics has been reporting developments in UK society for over 50 years, starting in the Social Trends publication. On the 25th of November 2010, Jill Matheson, or I should say Dame Jill Matheson, our then national statistician, accepted an invitation from our then Prime Minister, David Cameron, to develop the measures of national wellbeing and progress. So as a consequence, we launched the Measuring National Wellbeing programme, and its aim was to develop a set of measures that capture what matters most to people in the UK. So Jill stated that she was convinced that development of these metrics is something that can only be done with an understanding of what matters most to people in the UK. Therefore, part of the programme included a national debate. And we went out and asked people what matters most in your life. And people were able to feed in through online participation, through media and events. And it was really important for us to make sure we got input from all walks of life. So we specifically went out and spoke to school children, those who were retired, and we spoke to charities, parents, including vulnerable mothers, Gypsy Roma travellers, different religious groups, hospital patients, carers, as well as other government departments, academics, and university students. So the consultation generated over 34,000 responses, and quotes included, as you can see on the screen, having good connections with friends and relatives to convey the importance of having a partner and sex. Well-being of my family and friends, good tea and coffee, nice food, good books, music, sleep. These are the things that matter to me. People also commented that it's long overdue that we start to understand the quality of life that may not, for some people, be based on wealth and possessions, and that it's important that we are creating a society that we are proud to hand over to our children and grandchildren. The 34,000 responses highlighted 10 areas of life, and these created the structure of the Measuring National Wellbeing Framework. These 10 areas are personal well-being, that was awkward, our relationships, health, what we do, where we live, personal finance, economy, education and skills, governance, and environment. So the debate allowed us to define what we mean by national well-being, which is how we're doing as individuals, as communities, as a nation, and how sustainable that is for the future. At the time, we had 43 measures selected for inclusion in our 10-domain framework, and we aspire that they all be available for the UK, be robust so that they meet the statistical requirements of accuracy, reliability, and validity, be comparable internationally, have a past time series, be up to date, be available in the future, and allowable for disaggregation. And as you can see on the screen, we first presented the measures through what we called the wellbeing wheel. However, we had accessibility concerns with this tool because it didn't allow people to see trends over time, when they were last updated, nor where the source came from. So, as we phrased it at the time, we moved beyond the dashboard we've moved beyond the wheel to the dashboard. So we have now an interactive dashboard. So the dashboard allows users to see the latest estimates alongside when they were last updated, track the series over time, link back to source data, and provides a summary of the data when you hover over it. We now have 44 measures, and they include a balance of subjective and objective. It considers our well-being now, for example, our personal well-being through our life satisfaction questions, and well-being in the future, considering hectares of protected areas of land and sea in the UK. Further examples of our measures include trust, both in government and between each other, and employment, belonging, whether people are finding it hard to get by financially, greenhouse gas emissions, just to name a few more. And relating back to our definition, we cover well-being of individuals, communities, and as a nation. So we source these from across ONS and also government and non-government sources. Impact and successes of our framework have been wide-reaching. So from organisations and departments picking up the framework to carry out their own assessments of their own work, through to the ONS 4 personal wellbeing questions established as part of the programme, being used as the headline metrics of the UK's Department for Levelling Up Communities and Housing, or Housing and Communities, Levelling Up mission on wellbeing. So throughout the framework's existence, we've either provided quarterly or 6-monthly updates, and with either summary reports or deeper dives into each of the 10 areas in the UK. But during 2020 and 2021, at the height of the COVID-19 pandemic, we didn't provide the updates to the dashboard because at this time we focused on providing timely updates of wellbeing and an understanding of, and trying to understand a deeper understanding of who and what was driving the changes during the pandemic. But moving us forward through to May 2022, ONS took the next step in its Beyond GDP work plan and began publishing climate change insights along GDP. And then in August 2022, the Measuring National Wellbeing was added to the suite of publications on that day. So we now provide the releases representing the 3 pillars of economy, the environment and society on the same day to provide a holistic picture of how the UK is faring. So moving forward to late 2022, our review. So it has now been 13 years since the start of the programme and the start of the national debate. It's 12 years since we started publishing the dashboard, and the development of dashboards both domestically and internationally, and literature published over the last decade confirmed to us that our 10 domains were still relevant. Also, the recent events of the current cost of living crisis and the COVID-19 pandemic allowed us to reflect over the domains such as health, our well-being, our relationships, our finances, and really solidified in our minds that the 10 areas that we already capture are still valid now as they were a decade ago. But what we really needed to get out of this review was to reflect on whether we're capturing the right measures within each of those 10 domains. We also wanted to check whether the dashboard is meeting user needs. We moved to the dashboard in 2017. Are people really using it in the way that they need to? Is it presenting the information how they need it? And so in October 2022, we began a review. So this review has been done at pace, but we did want to engage with as many people as was possible. So we ran a review survey for 10 weeks, which ran between October and December of last year. And this asked people what mattered most to national wellbeing, but also allowed people to feedback on our current measures, our title, our outputs, their use and suggestions for the future. And we complemented this survey with additional research in our opinions and lifestyle survey to again ask people what matters most in our communities and to themselves, to around 2,000 people. We also engage with stakeholders in local areas, in central and devolved government and international organisations, as well as wellbeing organisations and charities. We undertook qualitative research with groups at risk of low wellbeing to ensure representation to all in society. And additionally, we brought together research on key reviews to date and reviewed an additional 17 dashboards, domestic and international, to compare how others are doing it to help us identify gaps. So during this review, we've been supported by a technical advisory group of both government and non-government organisations, and all aspects in the review have culminated in a recommendation report that I was hoping would be out in spring, but I've been told July no longer defines spring in the UK, so it's going to be July. I did try that when it didn't wash. So I'm going to talk you through 2 bits of research that we have published today on our review. And the first one is around our findings on individual and community wellbeing. So here are the 2 questions that we asked respondents. First was an open text: what matters most to your own well-being? So we wanted a question that was really similar to the one that was originally asked in the debate a decade ago. And we wanted it to be an open question to allow for the identification of gaps. What are we missing? What's different to what there was a decade ago? The second question was closed, but this one asked about community. Ideally, we wanted this to be open too for the same principle, but the survey didn't allow it at the time, so we had to compromise. So So some of the results. So we received 2,173 responses. Each of these was coded into themes, and we had 15 broad themes emerge. These we then quantitatively analysed, and this is what you can see as the chart on the screen. At a headline level, overarchingly, people prioritised their family members and their welfare as the thing that they found was most important. Very closely and non-statistically significantly different was physical and mental health. And then thirdly, financial security followed behind. We analysed these results by age and sex, but we also analysed it by whether the respondents had answered low well-being, which we define as between 0 to 4, on any of the 4 personal well-being scales to identify whether there was anything happening in different sections of society. And just to clarify, the ONS 4 personal well-being questions is life satisfaction, whether you think the things you do in life are worthwhile, happiness yesterday, and anxiety yesterday. There was no statistically significant difference in the reporting of what matters to your individual well-being between males and females. However, there were some differences by age group. So as age group increased, so did the emphasis put on health. And then as age group increased, the percentage of people mentioning friends, relationships, and social interactions decreased. Next is I say interesting one, and I puzzle it a little bit, which is when we looked at those reporting low personal well-being, they were less likely to prioritise physical or mental health as important to their individual well-being. Now, when we look at the demographics of this group, they were more likely to be 16 to 29 or 30 to 49, who also happen to be the age groups who are less likely to report health. So obviously there's something going on there, but we haven't done any multivariate testing on this yet to try and really disentangle of what's going on, but I just wanted to highlight that. So moving on to community well-being. So when we analysed the responses to community well-being, as you can see, feeling safe overwhelmingly came off on top. And that was both true for males and females. But interestingly, although they both report feeling safe as their top priority, the thing most important, more females than males reported feeling safe as their most important aspect. And this was the only statistical difference between males and females. As with individual well-being, some intergenerational inequalities did exist. So feeling that they would be included and having their voices heard was selected at higher rates in the 16 to 29-year-old categories than those in the 70 years and over categories. The second piece of research then I wanted to share with you are some high-level findings from our review survey that ran at the end of last year. So we ran a stakeholder engagement exercise, which specifically purpose was just to ask for feedback on our measures. So as I said earlier, we inquired about the suitability of our title, our measures, our sources, our publishing frequency, as well as how users access and use our products, and we asked them to suggest any improvements for the future. We also utilised this opportunity to ask people what they felt mattered most again, but this time to national wellbeing, reflecting that, as I said, we had a 3-level definition. We've now asked on individual, we've asked on community, so this was an opportunity to ask for at a national level. We received 118 direct responses and then 2 that came in via, well, they said email, letter, and attachment. So our user and stakeholder survey asked respondents for direct feedback on how we measure well-being in each of our 10 domains and whether there are any indicators that we should add or change. We very helpfully received over 600 comments, and most of these 600 comments included suggestions for new or additional measures. So we tried to summarize this as best we could into key themes and topics for inclusion. So examples included do not conflate mental health and personal and subjective measures into one domain, which was happening at the moment in our personal wellbeing domain, and a piece of feedback that we had a lack of measures on public services in the UK. As I mentioned in an earlier slide, we use this opportunity to ask people what mattered most to national wellbeing. So as I've said, national wellbeing this time to do the hierarchy of our definition. And here we see really similar themes that we've seen in our individual well-being, but this time at a macro level. So yes, we see good health, but we see it in relation to access to mental health support. We see things like a culture of care, support for each other, availability of social security and welfare, affordable housing, a stable economy, and again, trusting government. So wider feedback we had on our measures included overwhelmingly a greater emphasis on inequality. So they wanted it through the provision of more breakdowns, but also through the inclusion of more inequalities metrics themselves. They asked us to reflect more on how we consider children as part of the framework. So in the UK currently, we have a separate wellbeing framework for children and for young people. We were asked to increase the public profile of our measures, and we also had a demand for improved policy relevance and policy use of our measures. Now, when we asked for feedback on our dissemination, people really liked a dashboard, and people's preference was to see visual dissemination. They asked for a greater emphasis on change in the measures. They asked us to promote the dashboard further. And interestingly, though, there wasn't a large demand for a single number or an index-based approach, which is something that is often, I would argue, hotly debated and rather cyclical. So I'm coming up to the end. So this is our next steps. So originally I wanted to present to you our full proposal, but being a government department, we have pre-release and I can't share anything with you until it's in the public domain. But it will be in the public domain on the 5th of July, and I have no embarrassment in sharing with you the link to our event, which is hybrid. So if you want to see the results of our review and how we're planning to measure wellbeing and progress in the UK going forward, please do register for our event. And I think that's about it.
Thanks, Eleanor. I'm just curious, who's using statistics? Do you have any sense for that?
Yeah, so it's quite a mixed bag, if I'm honest with you. So it depends, well, first answer, it depends on which element of the statistics, but we have everything from policymakers using the personal wellbeing questions to social enterprises and housing associations contacting us about maybe our social capital element and wanting to know a little bit more about how they can utilize the questions in their own studies, and then they use ours to benchmark against. So they develop their own questionnaire. So sometimes it's used in policymaking, sometimes it's used in benchmarking, sometimes people are just using it for reference. But then, as I said, with the whole framework in itself, people are lifting the framework and replicating it. I believe Northern Ireland had replicated one of their own at the time, but I've had non-government organisations do evaluations of their own work, and they've evaluated how their successes have been through the lenses of personal well-being, our relationships and everything else. So it's used quite multifacetedly.
Thank you very much for your presentation. About the well-being, you are considering 3 dimensions of well-being, if I understand well: individual, community, and national well-being.
Yeah.
So my question is about these indicators are separable, of course.
Yeah.
And if you in the community and national level, do you use some aggregate data that are not from the individuals, that are not from answers from individuals?
Yeah, so we have both objective and subjective measures, and we consider our national measures to be coming through in our, more so in our environment, our governance and our economy domain. So we'd be picking up things like net national debt as a percentage of GDP. In environment, we pick up measures, as I said, greenhouse gas emissions, protected areas, recycling rates, and then governance, we have voter turnout. The other one obviously is trust, but that's a subjective, whether you trust in government, but we have voter turnout.
Thank you. So this is very cool. And I really appreciated you sharing the sort of participatory processes that you all took to get this information. I'm not sure if I missed it, but I'm wondering if you collected like any sort of like demographic characteristics or anything like that to like know who was contributing to the underlying data, like in this larger sort of review and evaluation of the previous version. And then also I'm wondering how you all incentivize participation.
Okay.
If at all.
So the Opinions and Lifestyle Survey, that is a survey that's run across Great Britain. It's run over a 2-week period. It's run every 2 weeks, and it roughly has a 2,000 sample at the time that we collect all the demographics that you'd expect, and we can break it down then by whatever the sample really allows us to do. That survey at the time wasn't incentivized, so it generally has been incentivized up until I think about 6 months ago. The incentive left. Sometimes we add it back in depending on the cognitive burden of the questions that we're asking. This is why I wasn't allowed a secondary open question, because the research that we'd shown had been too many open questions disincentivized people from completing the survey. So I was allowed one open question based on what was on that wave of the data, and then the secondary had to be closed. Our qualitative research was done with demographic groups who are most likely to report low well-being, and that qualitative research was incentivized.
So the last question by Pascal, we collect that together.
Yeah, that's fine.
Thank you. That's really, really interesting. You mentioned international comparability, and I'm just wondering, are you trying to link in with the OECD, what Carrie presented yesterday? And I'm just wondering, in terms of the instruments you're using, are you trying to choose those with international comparability in mind?
Yeah, thank you. I hope I didn't miss this. If you can just give a flavor of the recommendations. One thing that I'm super worried about is that the ONS4, what might be called the ONS4 on personal well-being, will be changed or in part scrapped or any of those sorts of things. Can you soothe my worries?
Yeah, I can. That isn't breaking pre-release. I can say to you straight away, don't panic, they're not changing. And Carrie actually spoke to me yesterday about the subjective well-being update in the guidance, and I was asked to give a commentary talk at one of their earlier workshops on it, and I had to say to her today, if you change them, why not? The feedback that we have overwhelmingly in the UK is that the most valuable thing we have is our time series, and they don't want us to change the questions for that basis. So I can answer that one easily. I can answer the next one easily as well. So OECD have been involved since the beginning. So it's back in 2010, OECD were part of, I believe, our technical advisory group, or whatever terminology we used at the time to set it up. We have routine conversations. When they revised their indicators, we provided commentary to them and gave advice on what they've done. And Kate Scrivens, who works with Carrie, is on our technical advisory group now as we're going through this review process. When it comes to international comparability, we're doing our best, but it's very difficult when domestically we're very different. So for those who don't know, in the United Kingdom, we have devolved administrations, and education, which then by default includes children, and health is all devolved. So I sometimes really struggle to get a UK-wide estimate in itself, let alone then to try and get it internationally elsewhere. So there's a nice balance that we're playing, that yes, we have international comparability in most, I'd say some of our metrics, but beyond that, I'm aspiring to get wider UK coverage. So one of the elements that I didn't mention as part of the feedback that we had is probably the biggest thing when we asked whether it was granularity, comparability or coherence, was comparability and coherence came up on top. So what I've been striving towards in all of this is just to try and get as great a level of aggregation in the data in the UK as I can, to then allow us to break it down. So across the United Kingdom, I can present a picture for Northern Ireland, Scotland, Wales and England separately. Doing our best.